Okay, we are going to be talking about skinfold calipering, what it's used for. I like to use it for anyone trying to change their body composition. It is a reliable, shown as much as 0.99 reliability for measuring body fat percentage, and also valid as well, but I'll speak to those a little more in the post here. But we'll use this for athletes trying to change their body composition. It helps them measure progress, keeps them on track and motivated, knowing that even if a scale doesn't change, that they can see a body fat change, and that can be helpful and motivating. What I'm going to communicate to Danielle is I want her to stand in anatomical position, which she is. I'm going to have her face the camera and do it now though. Let's take a step this way so we can be seen. I'm going to do the measurements along her right side. I'm going to ask her to be relaxed for these movements, so that's what you want to communicate to them, because a lot of people will try and flex, or they just get kind of nervous, so they're jittery and holding like really tight. I'm using the Parillo 9-site test. That's because that's what we usually do. I like the extra sites, and so I'm going to be basing it off of the Parillo 9-site. Okay, so the first one we're going to do is her bicep, and I'm going to punch these measurements into a website that I use that does the calculations for me. We got nice little expensive $200 calipers here. Applies even pressure. We're gonna round to the nearest millimeter on these measurements. I'm gonna grasp her skin and pinch it together, so it's a two-fold measurement. And when I measure, I want to measure about an inch above where my fingers are pinching. Okay, and I want to do that within about a second or two of pinching her, because what adipose tissue will do is it will flatten out. So if you pinch too long, then it starts to go flat. So you want to do it semi-quickly. For the sake of the video, I'm just going to measure all of her sites once, but normally they would request or suggest that you do them all twice, and they want all of your measurements to be within 10% of each other, and then averaging them together. Okay, so that would be the most correct way to do it. I'm going to do it all once, punch it in there, and go through it just for the sake of the video. The most reliable thing I like about this test is that it's reliable to itself. You don't want to have multiple people measuring you, because everyone's going to do it a little different. So Danielle might measure someone, a few percent different than I would. And that's okay, because what is really important about the skinfold calipering test is that you are accurate to yourself, because I don't believe this test to be 100% accurate to true body fat percentage. But as long as it's accurate to itself, then we can use it as a measuring tool and see progress. So it doesn't matter if the number I give her today is her actual body fat percentage. What matters is that I measured her last time, and we're going to compare it to that. Okay, so I'm going to be going back and forth, punching some of these numbers in. We're going to start with bicep. So with her bicep, we're going for a vertical fold halfway between the crease of her elbow and her armpit, about right here. Grab the skin, pinch, and then notice that I'm putting the caliper perpendicular to the skin fold. Okay, so I'm not going the same direction that I'm pinching, I'm going perpendicular to it. So I'm pinching right there, closest millimeter mark, I'm gonna throw that in. Okay, the next site I'm going to do is her chest. Okay, for women, this one is different than men. Okay, so it's halfway in between nipple and armpit. Okay, so, but for women, it's a third of the way in. So I'm just gonna get her about right here, diagonal fold, pinch, check it out, okay, 5, I'm gonna throw that in. Come on, website. Okay, next I'm gonna do is her super iliac. Okay, so for super iliac, we're looking at a diagonal fold 1 inch above her hip bone. Her iliac is right here. It's about right here. Diagonal fold, pinch, Okay, throwing that one in. Getting her abdominal next. We go 1 inch off of her belly button. Okay, so about that far in. Vertical fold, pinch. Okay, the next one I like to do is her thigh. And you're gonna go diagonal fold, middle of the thigh, between the crease of the hip and upper kneecap. So upper kneecap, you know, crease of the hip here, going right in between. Pinch right here. Okay. Now this is when I have them flip around, still staying relaxed. I'm gonna get her calf. Yep, we can see it in the video. Okay, so vertical fold at the widest point is what Parillo likes. Okay, so widest point, right here. Good. So and we're gonna notice we're gonna release pressure when you pinch, okay? So you're not holding on to the thumb thing. You gotta let off of it so that it puts the amount of pressure that it should, okay? Next one is her lower back. It's a horizontal fold, 1 inch above the hips and 1 inch to the right of the spine, okay? About 1 inch in, hip, top of her hip bone, right here. So we're looking right here, horizontal fold, okay? This one you gotta kind of dig in on sometimes. Okay. The last two, subscapular. This one's asking for a diagonal fold 1 inch below the lower angle of the shoulder blade. Okay, so diagonal about right here. Okay, punch that one in. And then the last one we're gonna do is a tricep. Okay, so Parillo's calling for a vertical fold halfway between the elbow and the shoulder. Okay, so talks about the acromion. So we're gonna go right in the middle here, vertical fold. (13). We're gonna punch this in. This will give us our results. Now, something I don't like skinfold calipering for. People that are extremely overweight, okay, it gets really inaccurate. If you are above probably a true, you know, I'm just gonna speak from experience, 35% body fat, then this is gonna be terribly inaccurate. And the reason is, when we're pinching, what you're feeling for is, I wanna feel for her muscle and then pinch the subcutaneous fat and separate it, okay? And if you carry too much fat, then I literally can't, okay? So if someone is distributing too much fat in that area, then it's impossible to separate. You end up just kind of pinching a big ball of it, and it's pretty inaccurate. So for those people, I would suggest that they go do a bod pod, hydrostatic weighing, or a DEXA scan, and those are gonna be more accurate for those populations that are very overweight. Okay, that's it.